Welcome back, ladies and gentlemen, to GeoVax's channel, a clinical stage biotechnology company developing novel therapies and vaccines for cancers and many of the world's most threatening infectious diseases. Joining us to give us some milestone expectations here, it's something to do with obviously the variants and COVID spiking back up. We have David, the Chief Executive Officer. Welcome back, sir.
Thank you. It's great to be here.
Always a pleasure to get you on. So I figure we'll kick it off with some catalysts. I know we're kind of heading into the last quarter of 2023, and I just want to kind of get into it. What's going on with the company? I know the government's doing some next-gen initiatives with the healthcare system awarding a remaining $3.6 billion. Do you guys have access to any of that? Just give us some full clerical insight on what you're expecting here.
Sure, it's excellent questions. Well, we do have near-term catalysts or milestones coming up. We think they'll fit very well into what the federal government is attempting to do. So we've got a near-term catalyst with Gedeptin, our product, which is in the phase 2 trial for advanced head and neck cancer. That study is going to be completed probably maybe even this month. The last 2 patients will enter that program, and then we'll evaluate that. We'll follow that. We believe that with the data we recently presented in July, we pretty much understand that the product is very safe, and it also is showing consistent shrinkage of tumors. So we believe we have the basis already to go forward to the FDA and discuss an expanded phase 2 trial, and one that could very well be the basis for registration review. So we're excited about that. We'll be talking about that more throughout the remainder of this year. So I'd say stay tuned for that information. We're quite excited, not only about that trial, but the inherent technology, which is pretty much what we refer to as solid tumor agnostic, meaning that it is not necessary to think about which solid tumor we're going after, because this technology is applicable to virtually any accessible solid tumor. And that's why we're so excited about it. It's an entire sort of a platform product, opens up an entire business opportunity of unmet medical needs, and also for us, obviously, a very nice business opportunity. You also mentioned the White House initiative, Project NextGen, which was announced several months ago. Indeed, a few weeks ago, the first $1.4 billion of the $5 billion was announced in awards, of which that is what 3.6 that's remaining. The federal government and the White House have indicated that they intend to complete awards of the remaining 3.6 billion by the end of September. That's end of this month, which is the end of the federal government's fiscal year. We have submitted recently a full comprehensive proposal for being funded on that behind our current phase 2 program to expand that. We believe that we are demonstrating consistently much broader, more robust protection. We believe we have points of differentiation in our favor versus the mRNA vaccines and the monoclonal antibodies, and we believe that the data that is currently in final review for pending publication related to showing that our vaccine, our COVID-19 vaccine, induces very strong, not only antibodies as all of the vaccines, the monoclonal antibodies do, but also the T cells, which gives us a greater breadth, greater durability, and we believe protective immunity for those who have compromised immune systems who currently are not receiving benefit from the existing vaccines. So we have a number of upcoming milestones, all of which we'll be discussing in the remainder of this year. Next week, we'll be at the H.C. Wainwright Global Annual Investment Conference. That'll be followed by additional conferences throughout the remainder of fourth quarter. So we plan to be rolling out increasingly more and more information in support of the value of GeoVax, but most important, of bringing forward some very important, critically needed tools addressing unmet medical needs that at the same time will strengthen the basis for our investors and for our company.
Definitely appreciate these insights. You touched on a lot here, and I just want to follow up with just a side note, a question, especially when it comes to your vaccine related to COVID. Are you guys finding that the variants have any effect on current vaccines, or how are you kind of playing within the realm of these current evolving, virus?
That's an excellent question. I was just asked on a radio interview last week about that. What everyone is seeing is that first of all, the virus is definitely going to continue to evolve. The variants of concern or variants are here to stay. They will continue to evolve. We'll have to continue to deal with them. One of the challenges of the existing currently authorized vaccines, the mRNA vaccines, is that they have to continuously be updated and be revised and reconfigured to be able to go after whatever is today's hottest, most relevant variant. Unfortunately, in the time it takes to conduct that work, we're now on to another variant. So we always seem to be chasing the next variant and being one variant behind. Where our vaccine differs and where we think is the data is going to further demonstrate a critically important differentiation is we have been able to demonstrate that our vaccine, which induces both antibodies as well as T cells, and is based upon the original Wuhan strain, so the ancestral strain of the protein, the targeted protein. What we've been able to demonstrate is protective immunity all the way from the ancestral strain all the way through Omicron, and including what was until recently the most alarming current variant, which is the XBB 1.5. So our vaccine has been able to show that it is a variant agnostic at this stage. So we've been able to demonstrate that we do not need to continuously go back and reconfigure. We may at some time upgrade and update the configuration of the vaccine, but right now a major point of distinction in our favor is that it is essentially variant agnostic, which we think is critically important, not only for those with compromised immune systems, but for the general population at large, and especially in the phase 2 trial we currently have underway, and which is very close to being completed in the enrollment, which is to evaluate our vaccine as a better booster on top of the mRNA vaccines, showing greater durability, more robust protection. So we believe that our technology has thus far been able to basically withstand the moniker of being a variant agnostic vaccine, which we're quite excited about.
Yeah, it seems like you guys have a lot going on here, and I really appreciate updating everything we can kind of just hopefully see unfold here with these milestones coming into the latter half of the year and into next year. But I'll pass that question off to the viewers. We'd love to know what you think about these conversations in that comment section below. And consider subscribing because as Catalyst and News obviously hit the wire, we're going to continue to update you here. But on that, we look forward to catching you in the next one.